The following segment is brought to you by Intermountain Healthcare and the Utah Department of Health.
People's life have been turned upside down. There's been a lot of societal disruption from people working at home, teaching kids at home. Sometimes you have to stand in line getting into the store.
A new study by researchers at Intermountain Healthcare finds depression remained common during the pandemic and worsened for some patients.
And we found that depression severity increased during the pandemic, and also the frequency of depression was also higher.
Researchers also saw increased visits to the emergency department for treatment of anxiety and chest pain.
And we also looked whether some of the anxiety was associated with chest pain, and we found there was a 1-point greater odds for those depressed. But we know that mental health, specifically depression, is a risk factor for a lot of chronic conditions such as cardiovascular disease.
Researchers say knowing depression and anxiety are linked to chronic conditions like heart disease highlights the importance of screening patients and providing mental health resources.
I think in the past there's maybe been a little bit of a stigma with mental health, but it's a real disease, and I think people need to be screened for it and adequately treated if they have found that they have some depression.
Mary Nichols for Check Your Health.